My name is Laura Gully, Director of Community Mobilization and Advocacy with Generate Health. I want to bring this warm welcome on this Friday. I guess it's still kind of nice out. It's beautiful. Friday morning / afternoon. Just to kind of get us started, if you can introduce yourselves by putting your name and organization in the chat. And what is a superpower? If you could have a superpower, what would your superpower be? So you can bless us with your talent or wannabe talent. Let's put it like that. So we'll go ahead and I want to give just a quick moment to recognize the elected officials that we have with us today on the call. We have Representative Ashley Bland Manlove. Thanks for joining us. We have Legislative Assistant Kanisha Gransberry for Senator Angela Mosley. Representative Michael Johnson. Thank you for joining us. Representative Tracy McCreary and U.S. Representative Trish Gunby. We thank you for joining us today. And I would also like to just give a quick shout out to someone working behind the scenes with Generate Health is our marketing and communications coordinator, Elizabeth Ward. So thank you so much for your help. Just a little quick note about Generate Health. We're a nonprofit based out of St. Louis. We unite and mobilize the region around some of our most pressing maternal and child health issues. We're committed to centering the voices of those directly impacted by racial and health disparities, and through education, advocacy, we work with direct stakeholders and advocates to accelerate positive change in pregnancy outcomes, family well-being, and community health. And we focus on addressing the root causes driving racial disparities in maternal and infant health, which is why this event this Momnibus Kickoff event is so important to us. We are pleased to be partnering with Planned Parenthood to help us coordinate this effort and bring attention to improving maternal health and more specifically, Black maternal health in our state. Nakia, would you like to say a few words about Planned Parenthood?
Absolutely. So joining in on this effort is Planned Parenthood Advocates in Missouri, which is a joint project of the two Planned Parenthood affiliates in Missouri. And Planned Parenthood Advocates in Missouri fights for Missourians' reproductive freedom in Jefferson City and communities across the state. Planned Parenthood, as many of you know, has been a trusted healthcare provider for over 100 years. And we know firsthand that reproductive and sexual health is critical to the health and well-being of women, men, and young people. But reproductive freedom in Missouri is under relentless attack. With the help of folks like you in this room, we can change the lives of our patients to bring Missouri to a more healthier state. And we understand that maternal health is crucial to doing that. So that is why we are here in this effort.
And Nakia, who do you have joining us with Planned Parenthood on the call?
Thanks for reminding me, Laura. We've got Mevi, if you want to introduce yourself, and Tiana.
Hi, my name is Mevi. I use she, her pronouns. I'm the director of Planned Parenthood Advocates in Missouri. Thank you.
Hello, my name is Tiana McGaw-Ray, and I am the Black Organizing Lead for Planned Parenthood, and it's good to see all the energy in everyone today.
Thank you, Tiana, and thank you, Mevi. We are excited to be partnering on this effort. So thank you all for joining us today. The purpose of us being together today is really to understand what the Momnibus is. Because I've had many folks ask questions like, what is the Momnibus? Tell me more about this and why should I get involved? So we'll be talking a little bit about that today, what's happening at the federal level around this issue, and if this is something that could benefit Missouri. We want to, take a look at that and dig in, and then talk about how you can get involved. So we hope to be able to cover that ground and hopefully in the future get into many more issues. So to kick us off, it is shameful that in the United States, we're still talking about this. It is the most dangerous country in the developed world to give birth. Missouri's maternal mortality rate is the 7th highest in the nation. And what's even more staggering is almost 80% of those deaths are preventable. So with the maternal mortality rate of Black women nearly 3 times that of white women, we know maternal death and serious life-threatening complications are a dire consequence of a much larger problem created by years of inadequate access to quality, compassionate, and affordable health care. So additionally, the Black communities have been disproportionately impacted by the spread of COVID due to the systemic racism and inequalities present in our healthcare system. So maternal mortality rates highlight just the existing disparities in our systems that impact women, and particularly women of color and women of low incomes. So the Momnibus builds on existing legislation to comprehensively address every dimension of maternal health, this crisis that we're experiencing in the United States. With the support of Representative Lauren Underwood, Alma Adams, Senator Cory Booker, and members of the Black Maternal Health Caucus, they introduced the along with Black Maternal Health Momnibus Act of 2021. It was endorsed by over 191 organizations. Now, we have had the pleasure, I hope they're on the call, but we have the pleasure of having someone with us here today to help us break this down and understand these issues. So she's also championing this effort at the federal level and can tell us more about this. Tiana has the honor of introducing our featured speaker. Tiana.
And yeah.
Oh, Tiana, you're muted.
I'm so sorry. I was saying, and yes, what an honor this is. This is a great crowd. This is a great way to kick off this effort. I have the pleasure today of introducing someone that I call a friend. I miss you, Cory. You're doing big things, girl. I just have to say that I was writing, and I was like, Tiana, this is Cory. Keep it real with the crowd and bring her in. So this is my pleasure. For over decades, many of us on this call have been advocating for Medicaid expansion as a key policy to improve Black maternal health. And thanks to all of that advocacy and the voters in Missouri, we won that policy change, and we look forward to its implementation. This is an exciting time to build on that Medicaid expansion win and look to what policy changes we can pursue to improve Black maternal health and reduce health disparities in this state. We believe we can learn a lot from the hard work going into advancing the federal Momnibus, which builds on existing legislation to comprehensively address every dimension of the maternal health crisis in America. Rep. Cory Bush is the original co-sponsor of the federal Momnibus and is a member of the Congressional Black Maternal Health Caucus. She provides an incredible perspective on this legislation as a nurse, Black mother, and activist committed to making concrete improvements in the lives of her constituents. It's very timely that we get to hear from Congresswoman Bush, as many pieces of the Momnibus legislation are included in Build Back Better Act, which is moving through the House of Representatives right now. So if you guys will join me with showing your emojis. Corey knows how I am. I am one of her biggest fans because we got her there to Congress. So if you would just join me in moving, clapping your hands, showing your emojis, just showing a lot of energy today, because we have with you, my friend, someone who we got together and we did it. Corey, you are there. I bring to you Corey, Congresswoman Corey Bush.
Hey,
girl.
Thank you. Thanks, everyone. It's so good to see you all. Seeing faces that I know and faces that I don't. Thank you all again. And thank you, Tiana. We've been working hard together for a long time. And both of us are in new positions now. But we've been doing this work for a long time. So thank you for all your advocacy. And to everybody on this call, good afternoon, and thank you for inviting me, new Congresswoman, to join you all here today to discuss the Black birthing crisis in this country. This is a conversation that most of you have been having for decades and raising the alarm, like Laura, you just said that, we're still having this conversation, raising the alarm about the 700 Black women and people a year who die during childbirth, and the 50,000 people who have near-death experiences while giving birth. We need urgent action to address what is happening right now. And as someone who has also suffered through pregnancy complications and traumatic birth experiences, I'm dedicated to continuing to raise this as a priority issue. And as a nurse, an activist, and Congresswoman, I'm committed to doing the necessary work to protect Black mothers, protect Black babies, protect Black birthing people, and all. As a matter of fact, the House of Representatives just passed, moments ago, just passed for the first time in 30 years, advanced pro-choice legislation. The Women's Health Protection Act will prohibit states like Missouri from enacting anti-abortion legislation. These policies are integral to our work to affirm our right to choose and protect the health and well-being of every person in our country. I am proud to have co-sponsored that legislation and to have voted in favor of its passage just a few moments ago. Now we look to the Senate to do its job. The Senate has to do its job so we can sign that bill into law. Like Tiana said, as a member of the Congressional Black Maternal Health Caucus, you all, it is our charge and it's our challenge to tackle this public health, this human rights crisis. That's what this is. In St. Louis, Black women and birthing people, and I feel like I've been screaming this for so long. I've been saying this over and over. It feels like year after year, 4 times more likely to die during childbirth, and sometimes, that number fluctuates a little bit depending on what part of the district in St. Louis you're in, but 4 times. Missouri ranks 16th in the nation for Black infant mortality, and these statistics outpace national averages. Still, I'm proud, though, to build on the leadership of each and every one of you in this room, on this call. It takes a village to protect our children and our communities. It takes a village to make noise around an issue when it feels like nobody is listening. Earlier this year, I testified before the U.S. House Committee on Oversight and Reform about my own birthing stories. I recall in one of my stories how my son was born at 23 weeks gestation. So I wasn't even 6 months pregnant yet, hadn't even crossed the 6-month mark. And he spent the first month of his life on the ventilator, fighting for his life, and the next 3 months in the NICU. I recall the dismissal of my doctor when I expressed concern during my pregnancy that something wasn't right. And the response was, "Oh no, you're fine. Oh no, you're fine. No, oh no, you're fine." Well, I wasn't, because he was born a few days later, 1 pound, 3 ounces. My story is the story of so many people who are pregnant and giving birth, who endure postpartum depression or substance use disorders, and for whom our healthcare system routinely and tragically overlooks. Racism is not a pre-existing condition in America. Racism is an existing condition in America. Our very existence as Black people living in America makes the threat of death a consistent and a persistent reality. As lawmakers, it is our duty and our responsibility to dismantle structural racism and inequity everywhere it exists in our society. So I'm proud to co-sponsor Rep. Underwood and Senator Booker's Black Maternal Health Momnibus Act to save lives, to end racial and ethnic maternal health disparities, and advance the birth equity that we need to see all across this country. I'm encouraged to see our collective advocacy has worked. And that last week, the U.S. House Energy and Commerce Committee advanced their part of the Build Back Better Act, which will include a $1 billion with a B dollar investment in key provisions of the Momnibus Act, which will make federal funds permanently available for states to expand postpartum Medicaid and CHIP coverage to 1 year in every state, including right in Missouri. Missouri gets a piece of a win. We're working hard, though, to ensure that this package, that it passes as quickly as possible, because we know it is urgently needed. But we also know that our work won't stop with that. It won't stop with that $1 billion piece of this package. It won't stop with what we're able to get into Missouri. Our work won't end until every single mother, every child, every person, everyone is protected, and until Black lives are protected. Again, it is such an honor to do this work in partnership with all of you, and I thank you. And just remember, if nothing else, your Congresswoman, whether I am yours or not, I claim everybody. Your Congresswoman loves you. Thank you.
Awesome, awesome. Thank you so much for your encouraging and inspirational words. We know you're on the front lines, and we feel like we're on the front lines along with you. So I am going to kick it to Mevi, who will kind of help us moderate fielding some of the questions that will be posted.
Thank you, Laura, and thank you, Congresswoman Bush, so much for all of the hard work that you're doing and the heart that you are bringing to it and your personal experience. That can't be easy to share that difficult birthing story, and we are so appreciative that you were able to share it with us and you're able to share it with Congress. Thank you so much.
Thank you. And good to see you again.
Good to see you. Yes, always good to see you. So we're asking people to put their questions in the chat. We've got you just for about 10 more minutes. And I know, though, Nakia has a question for you while people are getting their thoughts together. So Nakia, do you want to ask Congresswoman Bush your question?
Absolutely. Thank you so much for making time for us for this critical matter. We want to know, as we embark on this journey, we understand that there are several barriers, either it be at the state level, federal, or local level. Can you highlight some of those barriers and give us some wisdom about how to tackle those?
I think I can definitely speak from the well, I guess local, I guess it's local as well, but one issue that we have oftentimes that I see on the federal level, and then in talking to some of those within the state is, so much hinges on who we allowed into office. It's so much hinges on those legislators that actually believe that this is a partisan issue versus it being a human rights issue. And so that's what we face, whether people believe it to be so or not, that we need these investments in our communities. That is one part of the problem. They may believe it, but in order to stay on the partisan side, people do a particular thing. But we're talking about a human rights issue. We're talking about making sure that that the money that is needed to be able to give the healthcare that people need to be able to have healthy pregnancies and have healthy birthing experiences and then have healthy children, that we are providing that social safety net, and then that financial safety net, making sure that those doulas are available, those midwives, and whether it's birthing centers, and making sure that what our communities need, which may be different than what another community needs, that those pieces are in place. And that's something that we face as well. Being very clear about why different communities need different things is something that I know that we spend a lot of time on here with our colleagues, helping them to understand, even though you may not have been in this situation, this may not be what's going on in your community, but this is what's needed in ours. And so that's one of the things. The other is, right now with the Build Back Better Act, we're fighting to get the Build Back Better Act on Monday, trying to get that through. This $1 million investment is, people don't want to spend the money. People are talking about the debt ceiling and just the money. People don't want the investment in the areas where we're talking about. Sometimes people don't feel, well, no, not sometimes. What I see a lot actually is that people don't feel that investments in people and the investments in what especially people of color, what we need in our communities, what Black people need in our communities, that it's important enough to spend money on.
Thank you, Congresswoman Bush. I did want to share that Monique put into the chat that with her personal experience about losing a child for not being taken seriously, and also sharing other people's experience with having difficult birthing situations. And she can't thank you enough for sharing her story and fighting for our moms and babies. So I did want to convey Monique's thoughts to you, and thank you for leading the way, sharing your story.
Thank you. And thank you, Monique. I'm very sorry for you. Very, very sorry that the system failed you. Very, very sorry.
And Angie asks, also a constituent of yours, and is wondering how in a place where they are hostile to reproductive and social justice policies, how would you suggest as your constituent they advocate for the Momnibus, Women's Health Protection Act, or other policies that would help make things better? Any tips on how to make her voice heard?
Yeah. One thing that helps, and I know in some areas, if we don't speak particular names of things, if we come from the standpoint of this is what Monique, I think you said Monique, yeah, coming from the standpoint of this is what happened to me. This is what happened to me, not naming, the Momnibus, not naming, a lot of times we can't start there. We can get there, by the end of the conversation, but walking in, having those conversations with people, talking about, if you were to convene a meeting of people who have had traumatic birth experiences, or people who have had, just coming from the standpoint of part of the issue. This is how, because then it doesn't look like it's it doesn't look like you're trying to get somebody on a particular side, like if it's a partisan thing, or if it's it takes some of that weight off. And now we're just talking as two people who have walked through an experience together. That opens the door. And that's something that I was able to do when I took to the steps of the U.S. Capitol, when I didn't want to see 8,700 people in the Missouri's 1st District in St. Louis end up on the street, as well as 11 million people possibly around the country. I didn't know what to do, but I said, at least I have my own story, so let me put that story out. And people that didn't understand before were able to, I didn't know that. So those of you that are willing to speak out, I think that Because I didn't go with, like naming a particular thing. I went with, this is what it was like to sleep on the street in the car. This is what my kids went through. This is what, and I was able to make those connections. So I think that that's another way to do it. If, going through the side door of just letting it start with experiences. And once you start with those experiences, even if you only get 4 or 5 other people on your team in your direct community, those are 4 or 5 other people that then you're able to branch it out a little bit more, and then pull people in from other areas to be able to help.
Such great advice, and really people are saying in the chat how powerful and appreciative they are of your encouraging of sharing of personal stories. We also have a question from someone asking about how organizations can help further this effort. So maybe a group of people, maybe with or without personal stories. Do you have advice for us there?
For organizations, one thing that we're working on in Build Back Better is it's supposed to include a minimum of $75 million exclusively for those community-based organizations that do the work to promote like maternal health equity. So we need to, our work is to resource you. Our work is to help make sure that you have those funds. And right now we're working on that to make sure that those boots on the ground, that that you're our communities, you know what we need, and you know how to reach us. And so we're making sure those investments are there to make sure that those that are directly impacted, that are receive their help from those who have already been doing the work. So we need to be listening to you. And then also on our end, let us know what it is you need. I'm working on this end to help make sure that that 75 million starts to come your way. But then on your end, letting us know when things are coming up, if it's a grant, if it's a, so also in that way. And then as you are doing the work on the ground, I think that when we reach out into other areas where we don't have, so I know that these are some groups that are friendly to my cause. They may not have anything to do with my cause necessarily up front. Let me say, because it's all interconnected at some point, but up front may not be as connected. But that's where I go to be able to set up and push our agenda in those spaces. So we're talking about environmental issues. We're talking about environmental injustice issues. So we know that environmental justice issues, they do connect with what happens to our, when we're talking about maternal health, but it connects a little further along the line. Well, then maybe that's something that where we can connect and we can end up doing work together, with those groups, because that helps to further the message. And now you just pulled in some amazing advocates and some amazing people that are doing great work, to help further the message in spaces where people may not have heard it. And I think we can do that in so many different ways. So I think those organizations can pull on organizations and groups that are doing work in different areas. And which some of you have already been doing those things. But so much of what is broken right now in our healthcare system, it's that lack of equity, and making sure that that is at the core of all of our policy making is our charge. So I want to highlight and uplift all of the community organizers that have been out there doing the work. So make sure that you share your information with our office so that we can stay in contact and be able to work together. We want to do the work with you. We want this office to do the work with you. All are on the ground doing the work. We just want you to throw us the soft pitch so that we can hit it, but because we're not on the ground, if I missed something, it's because I oftentimes just didn't have the information. So if you all can share your resources, we can help more too.
Well, Congresswoman Bush, there are a few more questions piling up, but I know you've got to go. So okay. I think in summary, we'll get these questions off to you and we'll make sure we can try and get the answers back out to this group. But I think what I'm seeing as a theme in here, everybody wanting to take action. We are here looking at what we can do in Missouri, in the Missouri legislature. And if you could leave us with a little bit of encouragement that even in a difficult political environment like the Missouri legislature, that we should plow ahead with doing this in Missouri? Can you inspire us a little bit here on your way out?
Yeah, because you know what the thing is, you're all we have. You are all we have to do this work. That's it. So let me say this, Senator Elizabeth Warren, she came to me one day, we were outside, and it was right after we had found out it was, I think the very next morning after we found out we had the victory from the Biden administration. And she walked up, she kind of ran to me a little bit, and she said, she said, I had this thought when I came into the seat. And she said, and it's been a thought that I've had since I've been here, that does it really matter if I'm here versus somebody else? She said, you just answered that question for me. It does matter that I'm here versus somebody else. It does matter that you are here, those state legislators who are doing the work, fighting in a place where you have more than double of your numbers of people who are fighting against you. It does matter that you're there. And you have to be our voice for us, even in those moments when you are tired, when you feel low and beaten up, when you don't have anything left. Let us know, let us throw you some energy and some good love and all of those things. Let us throw some prayers and some blessings or whatever it is that you need your way. Your job is to let us know when we need to send that to you. Our job then is to be ready, because we need you to be whole there. And so while you're there, nobody on this call can speak for us the way that you can. So we send you what you need. And we thank you for standing up for us. We thank you for fighting for us. We thank you for doing the work. But let me say this. We talk about Harriet Tubman now, about the work that she did then, and she didn't realize the work that she was doing and how it was about to affect the history of this country and the world. She didn't know. She was just doing the work, what was in her heart to do. You do the same thing. You only do what's in your heart to do, what you know is right. Don't worry about what anybody else is thinking and what anybody else is saying. Sometimes you got to go it alone. You do what's in your heart. You do what is right. You do that good thing. Dr. King said the time is always right to do what's right. So do what's right. Let us catch the other stuff. You do what's right, and we got your back. We got your back. Call on us, and we'll stand with you. Because you're the only one you have that pen with your name on it. You have that key to that purse with your name on it that we don't have. So thank you for all you do. And we look forward to partnering with you more.
Wow, thank you. I'm going to shift myself to the gallery view, and hopefully you can see all the love coming into you, Congresswoman Bush, with the claps, the emojis, everything. Laura, I'll let you take over for the next steps here. Thank you, thank you, thank you, Congresswoman Bush.
Absolutely.
This is awesome. I don't know about y'all, but I'm fired up and ready to go. And I think what she said was, or the Congresswoman said was, it matters that you're here. It matters that you're here in this place right here, right now. So I just want to take a moment and just say thank you, Congresswoman, for your energy. We feel your love, and I hope you feel ours too.
I do.
So I thank you for your time today.
Thank you all. Bye, everybody.
Yes, all of that love and energy. We're just going to keep it going. If we do have a little bit more time to field questions, I do want to just pause for a quick second. We did have a couple of other elected officials join us. Wanted to just pay homage and give recognition to. We have Representative Lakeisha Bosley on with us. Thank you so much. I know it was around the block to get here, but you're here. And we also have, I believe it's Senator Rita Days Heard. She's joining us as well. Yes, awesome. And if there's others, did I get that wrong?
Council Chairwoman.
Thank you so much for, I stated correct, because maybe that's what I remember. I remember most.
Thank you for joining us, Councilwoman.
Yes, thank you. It took me some time to get here, but I'm here for a minute, okay?
That's great.
Thank you all so much. Appreciate it.
And if we have any others that we have not recognized, please unmute yourself and let us know you're here. Awesome. Okay. Well, let me just ask if there's any other additional questions, and I'm just
We have Trish Gumby too. We did Trish Gumby, State Representative.
yes, we actually gave her a shout out at the beginning. I'm not sure if you were on, but we did definitely want to recognize you as well.
Great.
I'm going to lean on my team to field any additional questions. This is, we do have a couple more minutes for questions and then we'll wrap up.
Well, Lori, I don't really want to ask a question, but I do want to make it known to the crowd how we want this effort to really, go somewhere in Missouri. And as, we do want African Americans to lead it, but we realize we need a force behind us with this effort. So I just wanted to take time to make sure people understood that it's going to take all of us and more, for us to get this to go somewhere in 2022 in Jefferson City. So I just wanted to add that.
Thank you for elevating that.
And I saw that we had Representative Bland Manlove on the call. Thank you so much for joining us. We really appreciate it. With your position at the Black Caucus, do you have any recommendations for us as we begin our journey and exploring different pieces of the legislation? How do we connect with representatives like yourself? How do we connect with the Black Caucus?
Sorry. I saw, thank you for acknowledging me at the beginning of the chat, at the beginning of the Zoom. I appreciate that. And I really appreciate the words from Congresswoman Bush as well. You can always reach out to us. We actually have a website. So if you just Google Missouri Legislative Black Caucus, you can send us an email, but the best way to help is always to contact your representative and tell them, what priorities mean the most to you. Because it means the most, as Congresswoman Bush said, when it is personal stories. It does help connect the dots and just makes sometimes the policy, more humanized. So, and you can always reach out to any of the state reps. Basically, it's our first name dot last name at house.mo.gov. So mine is Ashley, ASHLEY, .blandmanlove at house.mo.gov. So those are probably the best ways that I would suggest advocating, which you all know and do a good job of, which is why I'm on the call right now for you guys reaching out to us. So thank you for doing that.
Thank you, Representative. We appreciate your support. Any other questions? I'm gonna ask my team, any other questions that come in that we can field?
Yeah, Laura, a lot of questions are coming in about what next? What do we do? I feel some energy in the chat about it.
Great, excellent. So glad you asked. What can I do? We all have a role to play, right? And so part of what this is it's really like a call to action. It is really generate health, and Planned Parenthood are coordinators of this effort. We don't claim to, be the sole leaders. We want to build a collective table across our state that is certainly centered around building an equitable table that can address some of the most pressing issues. I think Congresswoman said it well. Who knows better about the issues that are impacting our community than the boots on the ground? And that's what we really want to do, is build that coalition of efforts that we can identify the things that our communities need most. I think Congresswoman also extended a bullhorn to let her know what we need as well. So we will be calling upon that as well as our local and state officials to support this effort too. So if you can, if this is something that is of interest to you, I know our team put in the chat a link for you to share your information. We will be in contact with you as we are developing and pulling together the planning team that can begin to coordinate this effort. So we don't want to leave you out. Please be sure to put your information in the chat. If anything else from the team that you would add?
There's a question about whether filling in this form is about Missouri or federal.
It's all about Missouri. What we were really hoping to do today is really understand, that this has been charged at the federal level, but some of the learnings that Congresswoman spoke of that we can lean on, we want to bring to Missouri and understand how we can build this. We know it's needed. We have some of the most disparate outcomes, and we want to address them. So this gives us an opportunity to shine light for our state. So that's what this will focus on. If you are interested, please sign up. It will focus on what is needed most in our communities here in Missouri.
Laura, if I may at this time, from the county's perspective, this maternal health is one of many efforts that are affecting the African American community. I serve the 1st District, which probably has as well as Councilwoman Webb, probably have the crux of the African American community in St. Louis County, and I'm only speaking for the county. And I also want to make sure that we understand that as we're dealing with this pandemic, we don't need a one-shot approach to this, because much of the issues that you're talking about and we're talking about, they all go together. When you talk of comorbidity issues, of course, maternal health is one of them. The people who are not getting the necessary prenatal care and care through their first months of even pregnancy and the children, they are all part of a comorbidity issue that is devastating our community. So I want to make sure that you understand that I understand we can't just take one and do one. We have to really embrace this as a whole message for the whole family. And I just want to make sure that you know that I'm working hard on that. I'm also working with Councilwoman Webb on that. We're looking at a holistic approach, which of course this includes, but we're looking at a holistic approach to improve the health outcomes of the 1st and the 4th District. So I just want to lay that out there to you. So thank you so much for having me.
Thank you for your encouraging words too and support. We know you've been a champion for a long time in this area, and it's nice to have you as well at the table.
Thank you, Laura. Are you telling me that I am old?
No. We call that wisdom.
I have to lighten up. I have to lighten up the room at some point, and so I do it at my expense. Okay, so we're good with that, and I'm fine where I am. So thank you so much. All right.
Thank you for being a champion. Thank you so much. All right, you all. Any other comments or thoughts before we close?
So speaking of age and maybe wisdom, of which I have a lot on the age and not so much on the wisdom, I want to take responsibility for putting the wrong version of a link in the chat. So if you clicked on my first link about the form, it was wrong. I'm sorry. I've done that several times now. Smarter, wiser, younger people have updated the link. So maybe scroll down and there's one that's much easier that ends with Momnibus interest. Use those links and you should be able to fill out the form. And we really, really do want you to fill out the form because, as Councilwoman Day said, there are all different levels of government at Missouri where we can look at what can be done to improve Black maternal health in Missouri. And I feel that Congresswoman Bush really challenged us to take all the smarts that is represented on this call and beyond to try and see what we can do together. And that's what this is the kickoff effort to do. So thanks everybody for using the proper link, and apologies for my putting in the wrong link.
Maybe we don't charge it to your heart. It is good to work with smart people, I'm telling you. So I'd love to have you on the team. let me
Lori,
just,
I wanted to add for everybody to go back to their organizations and talk about this. I mean, talk about the word. Momnibus, Momnibus, Momnibus. Look up the federal legislation for it and what's going on. You know, make it more known in your areas. There were so many people that didn't really understand what the word meant, or where we were going with this. And this is a kickoff to what we're trying to do as a big collaboration in Missouri. And the more we talk about it, the more we'll get the word out and we'll be ready. And thank you to everyone that took time to spend their lunch hour with us today. We really appreciate you.
thank you, Tiana. I'm gonna leave you with the words of Congresswoman. Do what's on your heart to do, right? And so we welcome you. Hope that you will join this effort. We don't have all the answers. We need all of the gifts and talents that you have, those that young, old, and in between. We need you, and hope that you will join us in this effort. So happy Friday to you. Hope you enjoy your weekend, and we look forward to connecting with you soon. Take care, everybody.